Hello, I am Professor Dr. R.A. Pandiraj, Mississippi, FRCS, FACS, a senior consultant surgeon, Apollo Hospitals. Now, I'm going to talk to you briefly about hemorrhoids. A layman topic is called piles. See, all of our human can tend to get piles because we are all two-footed. We are standing against gravity. But animals like even elephant or horse, cows will not get hemorrhoids because they are with the gravity. So, and one more thing leading to co-piles is constipations. So once you increase the pressure for more passing the motion, the blood vessel at the end of the anus, which is sensitive to sense whether you are passing gas or motion filled with nerves enlarge and develop piles, that is hemorrhoids. We have different grade 1, 2, 3, 4. The 1 is not visibly inside. 2, patient says comes out, goes out. 3, it comes out. Patient has to push in with difficulty. That time, the 2 and 3 only patient comes to us. Before that, they are ignorant. So the main complaints of the piles will be bleeding, passing mass that is flush outside anus, or sometimes they will come with the pain also, because that's the last complication of piles, where the piles burst and develops a hematoma. It's called perianal hematoma, or the piles come out and get entangled. It's called thrombosed piles. So these are the emergency, they come. So it's better to tackle them in the ST, early stage. Early stage drugs and modifying their bowel habits will help. Once they cross that second to third stage and fourth stage, it needs surgeon advice. We have different options of treatment. Conservative, we'll try. If it fails, we'll advise the patient for surgery. See, any surgery, let it be latest or old, the patient bowel habits has to change. If they are constipated, if they do surgery, they do anything, it'll be a failure. So that main thing is teaching the patient how to regulate their bowel. So I'll give a brief introduction of what are the latest surgery. One is the open surgery where we do Milligan-Morgan, that's called. We cut and suture it. Second, we have got to advance. If patient doesn't want surgery, we go for a conservative in non-invasive, or without anesthesia, we do some procedures as an OP patient. It can be a banding or applying an infrared coagulation on the piles, or I do a lot of sclerotherapy, giving sclerosant on the piles, which will be a temporary measure. It's not a permanent measure. But if the patient has bleeding, pain or mass coming out, this all will be succumbed by these methods. Permanent method is surgery. A latest surgery is doing a stapler. It's called stapler hemorrhoidectomy, that we are doing that. Other thing is using a HALS, that is hemorrhoid, artery ligation system. We identify the artery by the Doppler and stitch it. So the feeding vessel gets stuck on the... Now the latest is doing the laser hemorrhoidopexy, which is very helpful. So patient see the last two, that is a stapler, HALS and our laser. These what is the advantage is early recovery, and patient will not have much pain post-operatively. One of the main thing patient is worried about hemorrhoid surgery is after surgery they have pain for at least 2 weeks because of the raw area. Unless a raw area heals, the pain slowly disappears. But these latest things all alleviates the pain, so patients are in comfort. So this is the latest. If you keep your bowels regular with eating a lot of high fibers and avoid constipation, you can avoid piles. Thank you.